Let us hear the story of Mr. Jackson. Mr. Jackson, who is a 65-year-old businessman, is very much anxious about one of his physical problems. That is why he has made an appointment with Dr. Roy. After meeting with Dr. Roy, he is telling that, "Doctor, I'm noticing that recently I'm having some blood in the urine. I'm very much anxious about it. Can you please help me?" Now it is the job of Dr. Roy to solve the mystery of blood in the urine. So let's dive deep into it. So to solve the mystery of blood in the urine, Dr. Roy has to know from where this blood can come into the urine. This can come from the kidney, or the ureter, or the bladder, or due to some prostate reason, or it can come from the urethra. So how to identify from where it is coming? Dr. Roy can identify just by asking, when does it occur? Does it occur at the beginning, or at the end, or throughout the urine? If it occurs at the beginning, then the pathology is in the urethra. If it occurs at the end, then the pathology is either in the bladder or due to some prostate reason. If it occurs throughout the urine, then the pathology is either in the kidney or in the ureter. But the mystery is yet not solved. So what to do next? Next, we have to ask whether there is any pain or not. If there is pain, then we have to go to the USA, that is United States of America, where U goes for urinary tract infection, S goes for stone of the kidney or bladder, and A goes for autosomal dominant polycystic kidney disease, where bleeding occurs due to the cyst rupture. Again, this polycystic kidney can also happen in case of tuberous sclerosis and von Hippel-Lindau syndrome. Again, if there is no pain, then we have to think about CJPA, where C goes for cancer of the kidney, bladder, or prostate. G goes for glomerulonephritis. P goes for pulmonary renal syndrome. And A goes for anticoagulant drug. Mystery is solved, and Dr. Roy is happy. Now let's talk about MRCP PACES exam. At MRCP PACES exam, there is a certain trick. If anyone wants to crack the diagnosis earlier at the long clinical consultation station, then he has to go to the past medical history, drug history, and the family history as soon as possible. I personally call it PDF. So let's come to the causes of painful hematuria first. The causes of painful hematuria are the first, urinary tract infection. Urinary tract infection usually comes with past medical history of uncontrolled diabetes mellitus in the PACES exam, or with the history of taking some medicine like SGLT2 inhibitor. So this is how it comes in the PACES exam. Stone comes in the PACES exam with the background symptoms of hypercalcemia, which is due to hyperparathyroidism. And this hyperparathyroidism might be due to some genetic syndrome like multiple endocrine neoplasia type 1 or multiple endocrine neoplasia type 2A. So we have to specifically ask about the family history for this. Whether there is any family history of gland cancer, whether there is any family history of brain tumor. In case of autosomal dominant polycystic kidney disease, you will typically get past medical history of high blood pressure or family history of kidney problem, that is CKD, or family history of any family person dying from hemorrhagic stroke. So isn't that simple? Yes, it is of course simple. Now let's come to the painless hematuria. For excluding any cancer of any organ in the PACES exam, we just have to ask about triple L. That is loss of weight, loss of appetite, lumps and bumps in the body. In case of glomerulonephritis, two types of glomerulonephritis are important for PACES exam. One is post-streptococcal glomerulonephritis. Another one is IgA nephropathy. In case of post-streptococcal glomerulonephritis, you will typically get past medical history of sore throat, which will be 2 weeks back. In case of IgA nephropathy, there will be past medical history of sore throat that will be 2 days back. Wow, how simple is it? Also, SLE patient can also sometimes present with glomerulonephritis symptom. For pulmonary renal syndrome, there are of 2 types. Either ANCA positive or ANCA negative. ANCA positive pulmonary renal symptoms are granulomatosis with polyangiitis, eosinophilic granulomatosis with polyangiitis, microscopic polyangiitis, and ANCA negative are SLE and good posture syndrome. For the PACES exam, GPA and EGPA are the most important one. EGPA can come in the PACES exam with a past medical history of long-term bronchial asthma, which is recently not being controlled in spite of compliance to the medication, and also the patient can give you history of low-grade fever with joint pain, with loss of weight and appetite. Granulomatosis with polyangiitis can come in the PACES exam with a past medical history of repeated upper respiratory tract infection, and after entering the station, you can find some evidence like depressed nasal bridge or loss of nasal cartilage. So this is how this comes in the PACES exam. For anticoagulant drug, this usually comes at the PACES exam with a past medical history of valvular transplant, that is metallic valve transplant, and with a drug history of taking warfarin. But there is a twist, because with this drug history, there will be a recent history of taking any antibiotic like macrolide or any antifungal like fluconazole that has increased the effect of warfarin, resulting in blood in the urine. So this is all about hematuria.